Today we're going to do the lip lace procedure. Lip lace is a perfect alternative for somebody that wants a little more volume in their lips, but they don't want to go through fillers. They might have some apprehension to doing too much. This is kind of a subtle way to kind of get into it and just get a little more confidence, get a little more smile. And it's a way that we can kind of get into it where we're rebuilding the body's natural collagen to replenish the lips that you lose over time. You lose some volume. So this is a good alternative to start with to see if it helps fit your need. So what we're doing basically is we're actually regenerating collagen. So with the heat of the laser, the erbium YAG laser, we go in here and we'll kind of stimulate that. It'll break the collagen down, but when it reforms, it'll form it and actually be more plump. Usually the sequence is about every 3 weeks. And you'll do anywhere between 3 and 5 sessions to build that up. And then after you get past the buildup where we're happy where we are, then there's a maintenance usually to kind of keep it up about every 6 months. So that's kind of where we are with that. Now it is regenerative, so over time, because it's not filler and it's not fake, over time it's just going to break down again. So there is some maintenance to do. And the younger you get going with it, the better, and less treatment times you have to do. Typically it's about 1 treatment per decade of life. So somebody that's 30 is going to be a minimum of 3 treatments. Somebody that's 50 is going to be about 5 treatments. Okay, and then still that 6 month comes out. And this is Elizabeth. She's one of our hygienists, and she's volunteered to do this today. And all we did was put a little topical. Some people do it without topical. Our experience is the more moisture there is on the lips, the less discomfort there is. So we'll be asking you to lick your lips constantly while we do this. Afterwards, we usually give you a little vitamin E, little capsule, and you just do that for 2 to 3 days. We want to keep it really hydrated, stay out of the sun. You can use like some Aquifer or Vaseline on there as well. These are just little eye protection, just for the laser. We always put those on patients just to protect from the laser wavelength of light. Now what we're going to do is just do a little preheating. This is a little ND YAG laser. And this just preheats. This is painless. It just, sometimes actually people say it feels good. It just kind of pre-warming our site. Turn towards me. How's that feel? Is that okay?
I don't feel anything.
So we're just doing a few little passes with that, just warming up the tissue before we use the other laser, which is the erbium YAG laser. And that's where we actually get the collagen regrowth. All right, so now we're going to do the erbium YAG. This is the lip lace procedure. And you see here, there's a little matrix that kind of, when I shine it, this is just the aiming beam. It just shows me where I'm going to deliver the energy. And we're just going to kind of just like we're painting the lips here. And we're going to just do this. And I'm going to have you, Elizabeth, just lip your lips. Lick them. Lick the top. We'll do the top first. Good. All right. All right, lick your lips again. All right, lick your lips again. Okay. And you can see she's already getting a little bit of a little plumping right here. Lick your lips. Okay. Your lips. Okay. And we usually try to stack about 4 stacks in the areas we're trying to work. Now I'm going to grab a little gauze here just to roll. Yeah, so if you see here, you're ready to get a nice definition here. We're going to do a little more accentuation here right at the vermilion border here and get a nice little pop into the lip, little pursing of the lips here. But we're going to do a little bit right here now. And it's going to make it go up even a little bit more. The mucosal layer is the inside of the mouth. Usually there's a lot of moisture there already, so usually the sensitivity is very minimal there, and sometimes they don't even feel it at all. Maybe you see here, Elizabeth's really tolerating this really well. Okay. Okay. All right. And what I'm doing way in here, what this does here, when you get a little bit higher here, it'll help this here kind of constrict a little bit here to kind of make that pop out like that. So it kind of makes it pop so it pierces up a little bit. Now what we're going to do here is accentuate right here. Lick your lips. Lick your lips. Okay, your lips again. Okay, now we're going to deliver a little bit extra energy right here. The philtrum here, this is where you get the Cupid's bow. And we're going to try to develop that for. Lick your lips for me. And we're getting a little inflammation, which is what we want right now, because that's blood supply going to the area, and that's going to feed that area, and it's just going to help as that collagen starts to reform and rebuild. And in the beginning, you'll lose a little bit of volume after the first 24 hours. You lose about 30% of that, but then it'll start rebuilding in over about 3 weeks. So it'll start rebuilding and rebuilding. That's why we have to do those sequences and do it 3 more weeks later after that framework and that scaffolding is formed, so we can just keep building on that collagen. So that's what we want to do. Now we're going to work a little bit on the bottom. Lick your lower lips. Okay, lick them again. Okay, and then you want to accentuate that middle part here to kind of get that little, where it pumps out a little pucker right there. And lick it again. And what I like to do is kind of go around this little border here. Okay, good. Okay. And we're going to do the same thing on the inside here. Okay, lick them. So I start to pop pretty good bit right there. This is a nice alternative just if you don't want to put anything foreign in your body. You want your body's natural just collagen to just reform it. That top looks really good. I'm going to do just a tiny bit right here. You okay, Elizabeth?
Mm-hmm.
Then I'm going to do the same thing right in here. And that's just going to make that kind of pop a little bit more on the bottom. Close down. All right, lick them. Okay. Pretty good. All right, how's that feel? I'm gonna let you look at it. Do we have a mirror in here? Can you get from Kathy? There's a mirror in there. And ask Kathy for some vitamin E for Elizabeth. Was it gay?
No,
Yeah.
it didn't hurt.
That when you use that, your lips look nice.
It didn't hurt.
And Dr. Marks, do you just go by what the visual looks like?
Yeah. Now there's a minimum. Usually we'll do at least what we call stacks of the light. We do the stacks of the light that goes in there, and it'll just kind of start that inflammatory process going and getting that collagen. First melts down, but like anything else, it's like muscles. When you work out, you break down your muscle, and when it rebuilds out bigger. Okay, and that's what happens with the collagen. Where we kind of break down that collagen. When it comes back stronger, and it comes back more. So we have that scaffolding. Especially somebody young like Elizabeth's going to really build that collagen a lot quicker. So it's nice to kind of get that going early on. Just to get that benefit of rebuilding that collagen. Then maintaining it's easy, because once you get that framework and you have the lips where you want them, that volume you want it, then you just maintain it. Go every 6 months and get it done. Sometimes every 3 months. There's some people that do it every 3 weeks. You can do it every week. There's some people that do it once a week, but that 3 weeks is probably that sweet spot. That 3 to 5 weeks. So she did real well, but it looks good. Yep. Right here, this right here is the Cupid's bow. So sometimes you'll deliver a little bit more right there. Go ahead and lick your lips for me, just to get that accentuated. And what I do is I'll kind of do a couple extra little doses right there, and then what I'll do is I'll use this little Q-tip here just to train where we want that to kind of start going. Lick your lips again. And we're going to do one more thing here that I just saw. Right here, but this one. And the inner mucosa, since it's like I said, since it's already kind of moist, really there's minimal discomfort right there. This is a great alternative, though, for somebody that wants to maybe enhance their lips a little bit, but it's not ready to make the jump into fillers, wants to try something natural. This is perfect. And if you change your mind later on and you don't want to enhance your lips more, it's natural, so over time it'll go back to where it was if you don't keep maintenance. So it's something that's very reversible if you want to, or you can maintain it and keep going. Okay, yeah, looks nice. And this vitamin E, we'd like them to do that for the next 3 to 5 days, just to keep rehydrated, because what it's doing is it's just really resurfacing the lips too, so it's drawing all that moisture out of it, so it just sucks it dry. That's the big thing, is you just have to use that. But yeah, looks pretty.
So I just had the lip lace procedure. It took about 10-15 minutes. Didn't hurt at all. Didn't feel anything. Really quick, really painless, and I'm really happy with the results.